Bismillahirrahmanirrahim. I'm actually very happy to talk to you about this topic that I'm very passionate about, which is related to smoking cessation, and which is also one of my main jobs. Part of my living is to help people quit smoking. So this talk can be helpful for someone who is a smoker and has some desire to quit or wants to know more about how to do it, and also can be helpful for a lot of us who don't smoke. But we may know people who smoke, or we may give advice sometimes to those who smoke. Is there anyone here who has never smoked? Okay, probably maybe less than half or about half who have not. For those who have never smoked, have you ever tried to convince someone else to quit? Just raise your hand. A lot of you have. And how many of you have been successful? Once you told them quit, they said, yes, we're going to do it. One person.
But it's very hard for him.
But they did it.
Yes.
They did quit. Fantastic.
But then he gained weight, then he goes smoke again, then he lose weight, then a lot of stress himself.
Okay.
So his body is actually confused, not himself. His body is, he wants to smoke.
Okay.
And I have some product in my car, to no smoke product also. I bring with me if you want it.
Okay, excellent, excellent. We may need that at the end if someone's interested. It's fantastic. And so the rest of you didn't raise your hand that you were successful also, so you may have found a big difficulty. And for those who do smoke, I want you to know that I have a lot of empathy for you. Okay, that means I don't blame you that you do smoke. I say, thank God that I don't, because I think I would have a hard time quitting also. It's very, very difficult to quit smoking. It's believed to be the most addictive compound we know. That means it's more difficult to quit smoking than it is to quit alcohol or heroin or cocaine. It's very difficult and it's very convenient. It's very difficult, especially if you don't live in California. Okay, if you live in the Middle East or in China, where everyone smokes and you can smoke everywhere, it's much more difficult. We have an advantage here. And for those of you, again, who don't, but you want to advise someone, I generally have one important piece of advice, and that is, do not try to push someone to quit. Especially if it's someone that you love or someone who's close to you, because most of the time when we do that, if we keep pushing someone, where do they usually go? What happens if you keep pushing someone? Where do they go?
Push you back.
They go away. Yeah, so they're less likely to listen to you. The more you push, the farther away they go. This is pretty true. So what can you do instead if you have someone who you want to help? The best thing to do is to listen to them. Try to understand their reasons, try to understand what's going through them. And you may want to explain to them that there is some help. So why is it so difficult for people to quit smoking? Is because the smoking addiction is believed to be three parts. One part is called habit, the other is called physical, and then there's a part that's psychological. What's a habit? Something you can do repeatedly without thinking. So someone can have a pack in their pocket, take out the cigarette, smoke it, and they don't even know that they did it. That's a habit. Physical means our body actually needs it. That means if you take it away, if you go on an airplane ride for 17 hours and you can't smoke, at the end of that 17 hours, whoever is smoking is ready to pull their hair out. The same thing can happen in Ramadan. But in Ramadan we have some extra power from Allah to help us. On the airplane we don't necessarily. So this is physical, and then we call this withdrawal. And then the last part is psychological. That means it's not a habit, and it's not physical, but there's something in my mind that tells me I needed it. Okay, for example, someone could have just finished 4 cigarettes, and then they go out, they get on the highway, all the traffic stops, someone bumps into their car, they get so upset, they light another cigarette. It wasn't the time for it, it wasn't a habit, they didn't need it physically, because they just had 4, but they feel they need it to relieve their stress. So if someone wants to quit, understanding those 3 components can make it much easier. The traditional way of quitting, we have a name for it. It's named after a bird. Anyone know it? It's called cold turkey. Okay? And cold turkey means you come to a lecture like this, Sheikh Abu Abdullah tells you smoking is haram, so you go out and you throw your cigarettes and you say, that's it, I'm never going to smoke again. Okay? Or what happens more common, someone goes into jail, for example. And that's it, they're stuck for 1 year, they're not going to smoke. They have no choice. They don't give them necessarily something to help. Cold turkey means you do it without any help. تبطل تدخين من غير أي مساعدة. Just instantaneous, spur of the moment.
Go to jail, there's going to be cigarettes.
Yeah, a lot of people, I don't know if they can't afford it or what their issue is, but a lot of people say I went to jail for a year, a couple of years, and I quit for that whole period of time. So, and that's a person who's forced. Frequently they'll come back to it. We have another approach. Not a lot of people can quit this way. So we have another way, which is the gradual medicated approach. And this needs the following components. Number one, you have to have some desire. The person quitting has to have a desire to quit. And the desire to quit doesn't have to mean that it's 100%, even if it's 50-50. A part of you wants to quit. Okay? And if you have that, then you need to set a quit date. If you're at the point where you're willing to set a quit date, we can then work to break your habit. And you break the habit of smoking in the following way. First, you make it very inconvenient to smoke. And that can be done by eliminating smoking from your house, from your car, and not carrying it on your purse. So don't carry them in your pocket. If you're a woman, don't put it in your purse. If you go into your car and you smoke in your car, put it in the trunk before you take off. Okay, and you're not going to smoke out of habit. You'll only smoke when you really need it. You keep doing this for 2 weeks before your quit date. Most likely your amount of smoking will decrease. Then on the quit date, we give you some sort of nicotine replacement. Something like the nicotine patch, nicotine gum. And we also have prescription medications. We have 2 prescriptions that are very effective. And we start some of these things, the prescriptions, we start before the quit date. The nicotine, we start on the quit date. Many people can quit in this fashion. The advantage of doing it this way versus cold turkey is if you go cold turkey today, you fight the habit, you fight the physical need for nicotine, and you fight the psychological need for nicotine all at once. So it's like you're fighting 3 people. If you do it the other way, you get to break the habit first while you're still a smoker, and then we help you with the physical so that you don't have the physical pain of not smoking, and you stay on that nicotine replacement or medicine for a few months until